this is me again, and I am crusading to stop the medical industrial complex mafia from endangering the life and the happiness of older people. When you go with propaganda, scare old people who have no knowledge of biology or diseases, and tell them that if you are over the age of 50, ask your doctor for colonoscopy, and then you go and bring a famous personality like Katie Couric of CBS News to do one on camera after her husband died of the disease. You implement a severe and fear and phobia against this disease. Colorectal cancer, like any cancer, breast cancer, liver cancer, or whatever, it is not specifically tied to an age group. Besides, that not every 50 years old and older should go through invasive technique that endanger the safety and the life happiness of these older people. The propaganda say that every, but the logic and the biology and the nature of the disease should say if you are highly susceptible. Being highly susceptible means that if you have a family history of the disease, clinical symptoms of the disease, if you are positive to microscopic blood in feces, which we call ocular blood, or if you are positive to stool analysis, which is done by immunoglobulin test, or known as DNA test of the stool. Those are the people who are highly susceptible. But to bring the whole 50 years and invade their private part, go through their colon and take biopsy, whether it is hyperplastic polyps or edematous polyps or whatever polyps it is. It is a very invasive, dangerous technique. And I went through this technique even with all my knowledge of pathology and microbiology. If they can fool a person like me with all this knowledge, they can fool anybody. The colonoscopy clinic looks like a Kmart on sale. Very old people, mostly women, who mostly, many of them lost control of their rectal muscles, and after colonoscopy start spoiling their underwear. Colonoscopy is very dangerous, invasive technique, goes from perforation of the colon to many diseases, diverticulitis, irritable bowel syndrome, and prolapsed rectum, every imaginable side effect that will shorten the life of the people who went through this technique. After Medicare approved payment, the number of colonoscopic procedures increased 400%. A doctor at Stanford who referred me to this technique called me some of the people there work 3 days making colonoscopy per week and making more than 1 million. Those thieves are stealing billions of dollars for unnecessary screening and prevent us from having a national health insurance. In UK, if you refer an old person without being monitored for the susceptibility for the disease by this lab test, they take your license away. You are a criminal. So I am in a crusade to stop this behavior, to protect our older people. Put your hand with me if you are 50, woman or man, and stop those asshole invaders which might have another hidden ideas of going through your colon. Stop this procedure, please. I did write to California Governor Arnold Schwarzenegger. I did write to the White House, to my senators and congressmen, and I will come here every day to pay attention to stop this abuse. Thank you, and I will see you in another video very soon to explain the biology and the significance of invading and disturbing the physiology and the anatomy of normal organs in prevention of prevention. Thank you. Have a good day.